Today we're going to talk about neuropathy. Interestingly, that lately I've been seeing more and more younger and younger patients, usually women, but also men, who suffer from neuropathy. And that's why I would like to talk about how can we support our neurons. Though in case of neuropathy, it is a peripheral neurons, right? It's neurons that live in our limbs and extremities, but also neurons in the brain, because it's the same tissue, the same nerve cells that comprise our peripheral neurons that propagate the impulse from the brain, but also in the brain. So everything we talk about here today in terms of supporting neurons for their longevity will be also applicable for central nervous system and neurodegenerative diseases like Parkinson or Alzheimer, right? So let's start with what is neuropathy? This is our agenda for today. We're going to talk about what is neuropathy, what are the symptoms of neuropathy, how does it start, some of the most overlooked cases of neuropathy and treatment options, and we're just going to talk about some of the new developments in the practice that I would like to share with everyone. So unfortunately, in conventional or traditional medicine, people who suffer from neuropathy can be offered only the pain medications, which is a Band-Aid approach, right? There's not really a lot of management or diving deep into the cause or root cause of neuropathy. And traditionally, we are trained as a practitioner, as a physicians, we train that neuropathy is a loss of a peripheral nerve function that is characterized by a variety of neurological symptoms. And we'll talk about those symptoms. And back in my conventional training, I learned that 60% of neuropathies are due to the diabetes, elevated sugar, because elevated sugar damages their delicate lining around the neurons. But later I learned that many other reasons for neuropathy that we can discover. They could be metabolic, meaning some other nutrients can affect our neurons' longevity and health. Circulatory, like blood circulation. So there's no circulation, neurons can be affected. Inflammatory, which is inflammation. Infections, that's the rising cause of neuropathy. Toxins, things like heavy metals, pesticides, or some other heavy-duty toxins that will damage the neurons. Past injuries, that's common sense. Then the other chronic diseases like autoimmunity. So who is at risk for neuropathies? First of all, of course, diabetics. But it doesn't happen overnight. It happens over time. So people need to be with established diabetes for years and years and years for this to happen. Unless their sugar is so highly elevated, and insulin is also so elevated. But also people with a poor nutrition and nutrient deficiencies. For example, elderly people who do not eat well, or a lot of even younger people now I see with the nutritional deficiencies. As we said, poor circulation or damaged blood vessels, and other chronic infections, viruses. But more and more we see that people present with a neuropathy because of their tick-borne illnesses or infections that are transmitted through a variety of the insects, mosquitoes, as well as ticks, and fleas. But chemicals, as I said, variety of the chemicals, heavy metals, some medications can cause neuropathy, and of course, alcohol abuse, because alcohol depletes us from vital nutrients, specifically B vitamins. Past injuries that can physically damage neurons, but also more and more of those chronic diseases like autoimmune disorders, kidney and liver failure. So, but most importantly, we always have to rule out insulin insulin overload and glucose dysregulation that can affect their neurons and increase immune decline and the toxin accumulation. So what are the symptoms of neuropathy? There's, of course, sensory symptoms when people start feeling this weird, strange sensation. Creepy crawly, I call them. We call them paresthesia. It could be light touch, pain from the light touch. So that has hypersensitivity. It could feel like burning. It could be feeling like numbness and tingling, but even balance problem. People start having balance problem without realizing that their nerves are not firing properly. And as a result, they have balance problems, especially common in younger people, in older people. But also motor nerve damage. So there's two different parts of the nerve, right? Sensory, the one that we sense, that are in the skin. So those sensory neurons will send the signal to the brain. So that's why we call them sensory. But also there's a motor neuron that sends the signal from the brain to the muscle when we are jerking our arm away from the hot pot or hot water. With the motor nerve damage or irritation, we see the muscle cramping, twitching, and variety of abnormal reflexes. So leg or arm will not move as quickly, or just an opposite, will be moving involuntarily. There's also autonomic nerve damage that will present as excessive sweating, heat or cold intolerance, even impotence, or feeling of their quick satiety. People just cannot eat because due to this autonomic nerve damage, they they feel the sensation of satiety much faster. Also, orthostatic hypotension, when people stand for a long time and they feel dizzy and sometimes even faint, it's another type of their autonomic nerve damage. So how does it start? How does this whole nerve damage start? As you can see on this picture on the left side, you can see that there's a healthy nerve cells, and it has this beautiful, this long propagating neuron that has a beautiful coating. We call it myelin sheaths. When damaging factors affect neuron, those beautiful myelin sheaths become damaged, and their impulse that's supposed to travel from the body of the neurons, that is on the top in the form of the round body, does not travel properly. It becomes either lost, so we're not getting enough impulse, or it spreads all over and does not focus in order to convey the stimuli. So again, it starts with their variety of the damaging factors that can cause inflammation inside of the nerve, and specifically those that will cause oxidative stress. So again, insulin, high insulin for prolonged period of time, high glucose level, a lot of inflammatory factors, so inflammatory signaling cytokines due to the infections or some other autoimmune factors. Again, toxins, we talked about heavy metals, mercury, lead, cadmium, all those things can affect and damage our gentle and tender neurons, but also protective factors like nutrient deficiency, like B12, vitamin B12 or vitamin B6, classic, even in the conventional medicine, cause of their neuron damage, but also inefficient or lack of healthy fats. Because remember, our cells are made of they require a lot of fat, because every membrane in our cells, including neurons, is made of fat derivatives, and we'll talk more about it. So all those triggers that I just mentioned will cause inflammation and oxidative stress inside of the cells and inside of the mitochondria. And if you add a little bit of their lack of circulation, that is the perfect storm to damage the protective covering of the neurons that we call myelin. And that picture actually shows how the damaged myelin sheaths create the problem with the neuron and create unhealthy nerve cells. So in traditional neurology, a neurologist is a specialist who usually works with the nerves and investigate the nerves. We do a variety of the different testing with the proper exam, physical exam, looking at the sensations in the hands and the feet, checking for the vibration, a prick sensation, or feeling of temperature. That is usually done by your neurologist. Muscle weakness in arms, hands, or legs and feet. Change in the gait. All of those signs can be signs of their dwelling neuropathy. Heart rate can be affected by that as well, because remember, heart is their part of their, has an innervation. Every beat is the result of the nerves propagating the impulse. Nerve conductivity, nerve conduction study, or electromyography. Those are the tests when we put the needle and read how fast their impulse can travel from the brain to their muscle. Even sometimes nerve biopsy can be done, especially for the cases of their small fiber neuropathies, the peripheral neuropathy. Sometimes in some questionable cases, people can have a cerebrospinal fluid tap. Also, the bladder, bowel, and reproductive organ functions can be affected. Sometimes we need to order MRI, but mostly we start with the laboratory testing. We're looking at the CBC, complete blood count, a metabolic panel, some inflammatory markers. Again, as I said, glucose and insulin, hemoglobin A1C, B vitamins, thyroid. We're testing for infections, and specifically for the stealth infections that are not so obvious, like acute flu or cold, right? Acute viral infections. Some infections can be very dormant, but they still can be damaging nerves very slowly. And of course, toxic exposure. So when we look at the MRI, we can find some bone infections. Sometimes skin can be affected. Soft tissue damage or nerve inflammation can be also detected on MRI. But with advanced neuropathy investigation, we, of course, looking at insulin. Not every primary care doctor looks at the insulins. More and more, I see that to be ordered routinely, which is a good thing. We look at the detoxification function of the body. We look at not just liver function, but we also look at the genetics. Does the person have a problem genetically to detoxify? That can point us into toxins as a culprit and cause of neuropathy. We also do investigational tests for the mitochondrial function. The organic acid test has been there for years, and we've been using it in functional medicine, but there are some newer tests like Prodrome Lab test that we're going to talk about. I usually also investigate thyroid thoroughly, not just by looking at the two markers that usually test the TSH and T4, but I like to look at their free T3, which is active hormone of thyroid, as well as reverse T3 and antibodies, autoantibodies. And of course, multitude of inflammatory markers, some of them conventional, some of them a little bit on the edge, like cytokine testing. We test the gut, we look at the leaky gut markers, because if there is a leaky gut, there's more chance for the inflammation in the body systemically. So why do we consider functional medicine labs? Because they actually help us to look at those not so obvious causes or triggers for neuropathy. And this way we can start addressing them more efficiently. So as you know, probably in the traditional neurology, we use the treatment options that have a Band-Aid approach. So it will be anti-inflammatory medication, pain medicines, some nerve blocks injections. Sometimes antidepressants will help not only with the pain, but also with the perception of pain, because pain is extremely debilitating. So people get depressed from chronic pain. But or gabapentin, opioids, unfortunately, as we know, the long-term use of those medications is extremely problematic because lots of side effects and they really poorly control the pain or neuropathic symptoms. And some of them, like non-steroidal anti-inflammatory medication, your traditional ibuprofen, naproxen, Motrin, or Advil that we all know and advertised on TV, they actually slow down and blocking the healing process. And recent studies actually show that opioids are marginal and not so effective in the treatment of neuropathy. Some of the traditional methods of treatment of neuropathy are a little bit more efficient, like physical therapy, compression stockings, using some devices like walkers and canes and providing people with more stability, also beneficial, but they're really just focused on mechanical aspect. Really, diabetic medications, of course, and counseling and working with some like nutritionist or dietitian would be extremely important to control the diabetes as a cause of neuropathy. With their functional medicine, we are actually looking a little bit deeper, as I said, and we helping people with anti-inflammatory diet that balances blood sugar, but also helps with the weight loss. We also look at the key nutrients. We do this micronutrients test to look, is there a problem with the nutrients? Are they deficient in B12? Are they deficient in other minerals or fats, like this plasmalogens, the new name on the block? You probably will hear more and more about plasmalogens that are amazing and very important building blocks of the nerves and protectors of the nerves. The key nutrients that boost detoxification are also very important. Nutrients that support inflammatory pathways. We also use a variety of other modalities like low light laser or cold laser. We use acupuncture to stimulate the nerves and protect the nerves. We look at their factors and treat the factors that can affect the gut as a source of inflammation. We boost the mitochondrial function with their intravenous laser. We're balancing metabolism, and that all of those things are actually not available in traditional medicine. And that's why functional medicine can give you additional approach and help. So with the case study, Ralph is one of the patients in my practice. He's 65, and he has been a long-standing diabetic. He has his conventional doctor who prescribes his medication, and he's been following him and followed their prescription. He's been taking his diabetic medications, but he still developed neuropathy because he never really addressed his lifestyle. We met a few years ago. He kind of learned about functional medicine approach, but it was too difficult for him. So he continued with his traditional approach. And after developing neuropathy, doctor put him on traditional medicine that is usually prescribed. It's called Lyrica, but it wasn't really working for him anymore. So he recently retired and currently walking with a walker. He tried the physical therapy, but only with a marginal effect. His sleep is really not good because pain at night will wake him up, and his pain medications are not really helping. So he really had no choice because doctor told him, we can get you some opioids, but eventually we probably would need to think about amputation if you're not going to fix your diabetes. But how do you fix it? Yes, he had a poorly controlled blood glucose, and that affected his immune system, and that was driving his inflammation. He had a leaky gut, and he was inflamed. All his inflammatory markers were elevated, and his mitochondrial dysfunction was causing the pain to be worse. That's our assessment. Well, few words about mitochondria. You know that mitochondria is the powerhouse of our cells. It's a very, very sophisticated machinery, actually, that we have in multitude in healthy cells. And each of those little organelles that presented here produces multitude of their energy molecules called adenosine triphosphate, or ATP. So healthy cells have lots of very efficient mitochondria. Unhealthy cells or damaged cells have less and less mitochondria, and the production of ATP becomes extremely unproductive or inefficient. So mitochondria play a huge role in the nerve sensitivity and how the nerves function. So if there is a lack of mitochondria in the nerves will not conduct impulse well, and the inefficient mitochondria will create a lot of oxidative stress, which is the rusting power or rusting force in the neurons. And as you know, the rusting force will create a lot of damage. So I use the metaphor here of the rusting because that's what oxidative stress does to our body. So when our mitochondria are working inefficiently, we develop a lot of fatigue, poor sleep, poor recovery, and a vicious cycle goes on and on and on. So mitochondria is really a big topic for that that you're going to hear more and more in terms of longevity, in terms of how we feel today and how we're going to feel tomorrow. Because healthy mitochondria, no matter where they are in the muscles or in the brain, will affect how we feel. So back to Rolf. We did the physical exam. We did our functional medicine exam, which is a little bit more detailed than the regular physical. We recommended him to start anti-inflammatory diet. He heard about it, but it was difficult for him to do it on his own, even though he knows what to eat. But with our health coaches who are helping him to resolve any blocks in maintaining a healthy lifestyle, keeping him accountable, and with the frequent touch points, making the small attainable steps help our patients to really succeed in implementing the right dietary plan and dietary changes. We little by little we implemented some genetic testing, some nutritional testing, including testing for plasmalogens. We did some mitochondrial testing, omega-3 fatty acids, which is very important because remember, omega-3s is one of the most important anti-inflammatory nutrients. We tested his gut. And again, all those tests are done one at a time. We don't need to do them all initially. But as we go, as he improves his diet, we can start implementing different tests. So we did some nutritional protocols. We gave him some nerve rebuilding nutrients and nutrients to address the inflammation. So he was really surprised to realize that there's an effective and alternative approach to his problem. And that there's some other hidden causes like inflammation may cause their nerve damage. And stronger band-aid medication wasn't going to get him to the root cause, but this functional medicine approach will help him. So as a result, little by little, in 8 months, he lost 40 pounds. His pain decreased from constant 8 out of 10 to frequently 2 out of 10. So he started seeing some light at the end of the tunnel. His balance improved. He began walking without any support. Remember, he was walking with a walker before, but he continued to do the physical therapy, which is very important. He was able to lower the pain medications and avoid, most importantly, opioid prescriptions. And his detoxification markers improved. So a couple of tests that I would like to introduce you that are really new on the market and really cutting edge, and functional medicine doctors as early adopters start utilizing this amazing and very interesting tests. So prodrome scan is the blood test, simple blood test, that has potential to see the health changes years and years and years before they show up. So that's why it's called prodrome. It's before we manifest clinical symptoms or diseases, we can see the trend through this test. It looks at the variety of the lipids in the cell or cellular membrane lipids that are strongly correlated to the clinical outcomes. either it's be neurodegenerative diseases like Alzheimer or Parkinson, or even cancer or mitochondrial dysfunction. So with this test, we can have a peek or introspect look at the future of their person's health and intervene earlier. It tests a very interesting particles that are called plasmalogens, which is the specialized lipids found in a very high concentration in the membrane of the cells, with the highest concentration of being in the most active organs in our body, which is brain and heart, as well as their immune cells. When we are born and we just continue to develop our nervous system, we get a lot of those plasmalogens through the mother's milk. As we grow older, we continue to produce plasmalogens in the organelles of our cells called peroxisomes. But as we grow older, peroxisomes, just like mitochondria, are not as efficient to synthesize plasmalogens. Therefore, our cells become less and less efficient in rebuilding themselves. So as a result, we age. So now when we see that plasmalogen level is decreasing, and that's where prodrome scan test helps us to see if the plasmalogen level is inefficient, we can start supplementing plasmalogens, helping therefore to extend the longevity of the cellular membrane, help the cell to be more efficient in production of their other important substances and just function better. So the plasmalogens play a very important role in maintaining healthy cell membranes and supporting communication between the neurons. And that's why it's so important in any condition that involve neurons, like neurodegenerative diseases, ALS, autism is a very big one, Alzheimer's disease, dementia, Parkinson's disease, but also peripheral neuropathies. So I am very much engaged and learning more and more about plasmalogens because it is really a new kid on the block. So plasmalogen may support your neuronal repair, function, and survival, and therefore offering longevity to the neurons. And we are as young and as healthy as our brain, because brain is our master regulator, master controller. So it is very important to maintain our neurons in a healthy state. So plasmalogens do improve mitochondrial function, and they are antioxidants. They help to resist that rusting that happens all the time. And if we have enough plasmalogens, our cellular membranes can maintain its health. So this all work comes from Dr. Diane Goodnow, who is their not a clinician, but he is a PhD in biochemistry. And he scientifically designed plasmalogens precursors that have amazing bioavailability. And they are designed so they are absorbed really well, and they can be delivered into your cell, can be absorbed through the gut and utilized by our cells as their precursor for synthesis of plasmalogens in the peroxisomes. And as I said, we can talk more about plasmalogens. Stay tuned. I'm gonna probably put another seminar just about plasmalogens and how important they are. So one of the products that specifically designed for regeneration of a myelin sheets around the neurons, it's called prodrome neuro. And it's great for improving the cellular performance of the neurons. It is based on omega-3, so it's omega-3 plasmalogen precursor that helps strengthen the synaptic membranes and optimize mitochondrial energy within the neurons. So both when neurons are metabolically supported and functioning efficiently, They create a stable environment for myelin maintenance and repair. That's the key word, repair. This is especially important in neuropathy, where impaired signaling often stems from both neuronal dysfunction and compromised myelin integrity. So you need to understand this pathway, that the better neuronal health will provide more efficient signaling and stronger support for myelination and nerve communication, and therefore it will lead to less neuropathy symptoms. But beside plasmalogens, we know that some other key nutrients that support a function of healthy neurons. It's your turmeric, it's your B complex that is with good condition, with good components of the B vitamins, all the 12 B vitamins, as well as some other nutrients that support methylation of the cells. And of course, your omega-3 fatty acids. All those three products are so important. And for some people who are genetically predisposed to inflammation or methylation problems, or unable to synthesize omega-3 fatty acids in the body, and we now can test you and tell you that you cannot do that genetically. So you need to supplement yourself with those nutrients throughout your life. So what is the functional medicine journey? It is a little bit different from your conventional setting, right? It's not a 15 minutes visit. It's about 90 minutes visit where we will investigate all your history from the time you were born, how you were born, was it a natural birth? Was it a C-section? How was your mother's health when she was carrying you or was pregnant with you? So we want to know everything about you. That's why it takes a little bit of preparation before you come and become my patient or patient of our practice. You need to complete this 52 questions questionnaire or survey. And when I read through it, I know so much about your lifestyle, about your nutritional status, what's your stress level. I already kind of have an understanding which direction we need to go. After this very extensive evaluation and learning about your journey, we do the testing. And it usually involves conventional testing as well as functional medicine testing with those interesting tests like prodrome or organic fatty acid to check your mitochondrial function if that's important. We'll then talk about what are the most important lifestyle modifications you need to make. Usually it involves the food, but more and more I see patients who are very motivated and educated. They already come with a clean food. Then we're going to start looking at their other factors, other pillars of health. What's your stress level? How do you resolve your stress? How much you exercise? Some people exercise too much. And when we exercise too much, we create more oxidative stress. So we need to support that. So every patient in our practice will receive our health coach, will be assigned to a health coach, and health coach will keep you accountable to accomplish most important steps in your health program. We will give you some resources for homework. You would need to get educated and be on the same page with us and understand why you need to do certain lifestyle modification and what does the specific diet do to your body. We'll then meet for the follow-up appointments and the test discussion. Usually it happens in about 6 to 8 weeks. And you don't need to do all the tests within that period of time, but some tests would be extremely important. And we usually guide patients through the process. And then after their initial visit and the follow-up, we develop plan and follow-up plan, and then we'll meet with the clients periodically. So this is a beautiful new machine that we have in our office. This is a new technology that I am very happy to bring for my patients. It's called photobiomodulation therapy, which is their laser that we use intravenously. And it's a low light level laser that is used for irradiation of the blood. And we have 3 laser right now. We have red, blue, and yellow. So they're all very fun to observe. You can actually see the light traveling through your artery, or I'm sorry, through your vein. And what does it do? It actually does a lot of interesting things. First of all, it stimulates mitochondria. So it enhances energy production, stimulate mitochondrial activity, leading to increased ATP, improving cellular function, and helps with the fatigue and low energy. We recently learned that it also improves oxygen utilization, but not just oxygen, but also nitric oxide. Specifically, blue light not just helps the nitric oxide to separate from the hemoglobin and travel through the peripheral circulation and cause the vasodilatation and enhancing endothelial function. But it also, what it does, blue light increases the length of the telomeres in the chromosomes of the endothelial cells. Endothelial cells are those that are lining your arteries and your peripheral vessels. And longevity of their telomeres is their marker for longevity of the cell. And therefore, we're now going to be seeing more and more data that blue light might be this one of those anti-aging factors or modality. And it also reduces oxidative stress, protecting mitochondria from damage and that can be caused by free radicals, potentially prolonging lifespan of the cells and functionality of the body. So that's basically all about neuropathy. If you are a new client or you're thinking about becoming client, please take this next step, schedule a discovery call with us. You can call the number that is on your screen. You can scan this QR code and sign up for discovery call with my team members. And we'll be happy to explain and answer any of your clinical questions and administrative questions. Many of you know that I also have a small presence in Florida, in Sunny Isles, northern Miami. So I am going to be there on May 1st in person to see my Floridian patients. So if you are attending the seminar from Florida, I hope I'll see you there on May 1st. Remember, we have this whole gut wellness program. If you're new to functional medicine and you do not know that gut is their root cause of many chronic illnesses, this is a great place to start and understand the role of gastrointestinal tract in your health. You can sign up for this program either from my website or by scanning this QR code. Remember, we have full suite of IV therapy. Please enjoy 25% off if on your first IV session if you're existing client. And just a reminder for those of you who are my clients and already did the genetic testing, our traditional lunch with Marina and discussion of the 3x4 test result, genetic test results will take place on April 20th. It's always the third Monday of the month from 12 to 1 p.m. So just put it on your calendar. And remember that friends don't want friends to go to their bad doctor. So if you're already a client and you know how we work and you want to recommend your friends, feel free to do so. And we're really grateful for that. Okay, so we're almost at the end. Thank you so much for joining today's discussion of neuropathy and functional medicine approach to neuropathy. As a thank you, I would love to offer you a code that you can use in our store, e-store, and you can get 10% off on our product, on all the products on that e-store, and this variety of options. Use this code for your purchases.